All right, the final part of this lesson number 3, it has to do with the various treatments to reduce cholesterol. This is important when you're working with clients to understand how these are treated, because you'll be dealing with working with patients who have high cholesterol, and they're going to use a variety of treatments. Some may come to you first for treatment before, or you may have others that will be on some type of drug. The first is treating HDL through without drugs. The first is exercise, and you have an increase in HDL can happen with moderate intensity. Here's a video or a slide that shows changes in HDL with different levels and frequencies of exercise. And what it showed is that frequent intense exercise. So this is exercise that is 30 minutes a day, 5 days a week at around 60 to 80% of heart rate max. So what the American College of Sports Medicine would recommend. So again, about 30 minutes a day, most days of the week is really what you need to do in order to increase the amount of HDLs in the body. Whereas if you just do infrequent, like once or twice a week, if that's either moderate intensity or even intense, it's not enough. It looks like it's the consistency and within a high intensity of around 60 to 80%. So for most of your clients, that would correspond to about a brisk walk or more. Also, alcohol raises triglycerides, but can raise cholesterol or raise triglyceride, but also reduce HDL levels, as we spoke about earlier. Reducing smoking and also losing weight can reduce HDL levels. There's also drugs called statins. I guarantee you'll be seeing patients that will be carrying or taking statins. They're a very popular drug. Their side effects, unfortunately, is muscle soreness and spasms, but statins are very effective at reducing the LDL levels. In fact, here's a slide that shows after a year of taking statins, the different types of statins. Here's the LDL in red, all other cholesterol in orange. Regardless of the drug and then how much, you saw anywhere from a 25 to 35, 40% reduction in LDLs and cholesterol levels. You don't need to memorize these numbers. This is just to show that statins are effective. Okay, but how do they work? Well, they work by decreasing or causing a decrease in cholesterol synthesis in the liver, which means you're going to have less intracellular cholesterol in the liver itself that could potentially be released into the blood. At the same time, statins also cause LDL receptors to be made more. And you have more LDL receptors, they're going to increase the likelihood of taking up more VLD or LDLs in the blood. At the same time, the statin helps increase the amount of the uptake of LDL and VLDL from the blood into the liver as well, thus reducing the amount of LDL in the circulation. So the idea is statins really reduce the amount of LDLs that make its way into the circulation. The other is vitamin B3, known as nicotinic acid. The way this works is that it prevents the uptake of, reduces the breakdown of adipose tissue to form free fatty acids. Less free fatty acids reduce the amount of, reduces their uptake into the liver. So you generally have a decrease in triglyceride synthesis or making of triglycerides in the blood or in the liver. If you have a reduction in triglyceride synthesis, that reduces the amount of VLDLs that are made by the blood, as we learned previously in this lesson. If you have less VLDLs, you have less VLDLs that can be released into the blood. Less VLDLs in the blood reduce the amount of LDLs that can be changed into or be made as well. As a result, nicotinic acid, vitamin B3, is very effective at reducing the amount of LDL in the body. Another way that the vitamin B3 is effective is it reduces or increases the amount of ApoA1 that's formed in the body. And as we know that ApoA1, the more ApoA1 that's formed, the greater the chances you have of increasing the amount of HDLs in the body. So here's just another example by which vitamin B3 can reduce HDL, or excuse me, reduce cholesterol and LDL in the body. And here's just another example where you have niacin in green, placebo in the orange, and it just shows that people taking niacin have a reduction in all sorts of cardiovascular events. Again, you don't need to memorize these. It's just to show the effectiveness of niacin. The last is omega-3. You may have people take omega-3 or fish oils in terms of their effectiveness, but this shows individuals who are on a placebo versus those that are on omega-3, and they really have a reduction in the bad cholesterol, triglycerides, increases HDL, reduces cholesterol, and this right here should be a reduction here, actually, of about this should be a reduction in LDL as well. So the take home is that fish oils tends to have a reduction in triglycerides and cholesterol. Interestingly enough, it seems to appear that the eating fish and getting your omega-3s through the fish itself has a better effect at reducing overall triglyceride and cholesterol levels than trying to get it or getting it from a vitamin supplement. Again, you do not need to memorize this pathway. The only thing you just need to know about is how omega-3 works, is that it reduces the VLDL secretion from the liver and triglycerides from the adipose tissue. And by doing that, that ultimately reduces the amount of cholesterol and triglycerides in your blood. So again, you don't need to memorize this pathway. Just understand this title here of what it does and how the importance of omega-3 fatty acids. All right, so this concludes the lesson 3 material, and also concludes the material for exam number 1. So make sure that you do all of the review on Blackboard, the thinking review questions, looking at the videos, and if you have any questions, please let me know.